Today we're doing the microneedling or CIT treatment. And the first step that we do is we cleanse the skin and then put on some topical numbing cream just to help with the comfort level on the patient. It's not a painful treatment, but this just helps make it a very relaxing and easy treatment for the patient.
So how long will this treatment take today?
So the treatment, we plan on about an hour and 15 minutes from start to finish with numbing cream. So right now I'm removing the numbing cream from the first part of the cheek area, and I'll degrease the skin before we get started. So the first thing I apply is some hyaluronic acid, which helps in a couple ways. Number one, it helps hydrate the skin, and then also it provides some slip for the needles. So I'm going to start really lightly on your cheek. You won't feel anything except the vibration. That feel okay?
Yeah, no problem at all.
Perfect. And it's normal to get some redness right away. And as I go deeper, pinprick bleeding is normal and common. Do different patterns, so kind of cross hatching, and I change the depth of the needle every time, so we're going into the epidermal layer and then the dermal layer. Does this feel okay?
It doesn't hurt at all. I kind of like it.
Yeah, I know. It's
almost like a
kind
deep
of
massage.
relaxing. Patients fall asleep in it all the time. Yeah.
So after the treatment, is there anything he should refrain from doing, or?
The thing, especially for men, is they have to be careful of no shaving for a couple days. So you're going to have a little beard this weekend.
Okay.
And also you have to be very careful of sun exposure. So, know to not be outside for long periods of time and be really good with sunscreen.
Okay.
Hurt at all? What is your?
It really doesn't. Not at all.
Now this is a tough patient. He's an F-16 fighter pilot, so
Yeah.
he is above the norm.
Supernatural.
But yes, exactly. But most people don't have a problem. Anything we apply topically post-treatment penetrates 85% deeper. So even if we just use growth factors and antioxidants, the patient could get a light peel from, but so that would help with sun damage, tone and texture of the skin, stimulating collagen and elastin, fine lines and wrinkles as well. Collagen production takes about 6 weeks. So this treatment, you'll start to see results right away, but it's really about 6 to 8 weeks till you see the full results, which is why when we do multiple treatments, I recommend 4 to 6 weeks apart. So the CIT can be pretty much done on any part of the skin. The neck is a fabulous area to add on to the face because as we age, the neck shows a lot of damage, and sadly we don't treat it as well as we do the skin on our face.
So you finished the treatment?
So I finished the treatment, and you can see the redness has already subsided substantially. So I rinse with water, and then I use a disinfecting solution before I go on to whatever serums or creams or whatever treatment product we're going to use post CIT. So the first step I'm doing on my patient is I'm applying some antioxidants to the skin. So that's going to help with all of the sun damage. And anything I put on topically is going to penetrate 85% deeper than if you were just putting it on without the microneedling or the CIT. Again, the act of the CIT alone is amazing for stimulating your collagen and elastin because you've got healthy skin cells surrounded by the damaged skin cells. So that alone just gives you cellular turnover. And then the icing on the cake is that anything else you put on topically is going to penetrate 85% deeper. And then again, depending on what your concerns or your issues are, we can kind of go from there on customizing the treatment per patient.
Well, the CIT treatment is completed. How was it?
I enjoyed it. It feels like it did a lot of good, and having done a few laser treatments, this feels like I look forward to seeing the results. It was not painful, and highly recommend it.